Hi everyone, Nurse Yalda from Rejuvenation Clinic. I'm here with my lovely patient and we're going to talk about one of my very favorite treatment, lip filler, lip augmentation. It's highly recommended to make sure we educate the patient correctly. The goal is to create enhancement. The goal is to create a beauty. We have to be respectful of our patient's age, their background, who they are, and what they do professionally. Obviously, we do have a patient who's a dancer and they need to look a certain way. We're absolutely going to provide that look for them. But we also have a patient that they work in government, so we have to be respectful of that. Lip augmentation not necessarily means making the lip bigger. Lip augmentation means to provide hydration. After age 30, our bodies start losing collagen. Our bodies start losing the fat pad that gives us beautiful support around the face area. So for this lovely lady, we're going to use 1 syringe of Restylane Kiss. It's a beautiful filler, hyaluronic acid. It's going to provide hydration, definition, creating a beautiful cupid bow. What I did already for her, I numb my patient with 5% lidocaine topical, but also I'm going to gently inject her with 1% lido, just a little bit dental block to provide more comfort for her. So go ahead, put your head back. So go ahead, just open a little bit. So pain management is very important, you guys. We have a lot of patients that they just don't want to continue certain treatment because of the level of the pain. So make sure you provide comfort for your patients. Couple of important things. We want to educate the patient as far as their post-op care. You want to educate your patient as far as their diet, the supplement they're consuming before their treatments. Anything that can thin the blood, like spinach, like kale, aspirin, leafy vegetable, even coffee can thin your blood. Therefore, it can also cause more trauma to the tissue, therefore more bleeding, therefore longer recovery. So be mindful to educate your patients, walk them through their pre-op and post-op instruction. Those are very important. So go ahead, close your lips. If your patients are just fine with a topical numbing cream, you don't need to inject them with dental block. But as I said, comfort is a key. Your patient is comfortable, therefore you can focus. One of the key that we see a lot between the providers, are we going to use the actual syringe or are we going to transfer our material, our filler, to the insulin syringe? I'm going to quickly show you guys how I do this technique. So I do have my Restylane Kiss. I also have an 18 gauge blunt needle, and I'm going to show how we're going to transfer this to the insulin syringe to make it easier, especially if we are a beginner and we try to be more precise. Also, if your patients, they're sensitive and you'd like to use a smaller needle. So we're gonna keep both needles sterile. It's very important to touch the bottom of the plunger. Keep in mind, this is the sterile part of your plunger and we shouldn't be touching that. So we're gonna grab our needle. We're going to insert a little bit inside the insulin syringe and we're gonna push about 0.1. So it's so important to not add too much filler to your insulin syringe. The issue with that will be, it's gonna be very hard to push your filler through the insulin syringe. You wanna have about 10 units basically of filler. And if you pay attention, you can see how easy it is for the product to come out of the needle and you will be more precise and more comfort for the patient. So for this technique, first I'm going to start with her cupid bow. It's so important to be respectful of the patient anatomy. She does have such a beautiful cupid bow. We're going to just add some volume, provide hydration for her. Guys, be mindful that with our lip anatomy, we're talking, we're eating, we're chewing. So constantly there's so much movement going on around the lip area. However, also it's such a very small border between the pink and the white. So we don't want to inject anything to the white border. And by adding or introducing filler to the white border or by filler migration to the white border, that's going to create that duck look that no one wants that. So please be mindful of your patient anatomy, and injecting slow is the key. And perhaps you may not want to inject your entire syringe for the patient. You can always use that filler for other part of their lips. You can provide some support always to the corner of the lip. You can also help to lift the oral commissure and provide more like a lifted. Unfortunately, as we get older, go ahead, turn this way. The corner of the lip, the angle shouldn't be downward. So one of the assessment that I do use for my patient, I do look at the angle of the lips. The angle of the lips should be upward. After age 30, since we do lose a little bit of a fat pad around the corner of the lip start going downward. So the ideal degree for the corner of the lip should be about 14 degrees upward to create more like a happier and lifted look. I always use emoji as an example. The happy emoji, everything is lifted. The sad emoji, everything is downward. So it's so important, not only we do a assessment for the lip area, we also have to do a quick assessment when it comes to the oral commissure and the tissue around the lip, because that's what gives your lips a nice support. We're going to start with her cupid bow. Go ahead, turn this way. Be mindful, bleb is up. Always inject through the pink side of the lip. Don't enter through the white roll. That's how you can create filler migration to the lip part of the white part. Little poke. Our depth, it is superficial, meaning it's sub-Q. I'm not through the skin, I'm above the muscle. And that's your space for a lip filler. I can see my needle, I can see the color, but it's not superficial. So therefore it's not gonna be injected to the skin of the lip. It is placed, the filler, we're placing the filler in the sub-Q. We're gonna follow the anatomy of her lips. And this is how we provide lift for the cupid bow. How you doing? Amazing. Perfect. Already you can see a little bit of elevation, more like definition. So this is how I do my cupid bow with using insulin syringe. But also I'm going to show a technique for you guys if you're interested to use just the needle that it comes with your filler. Again, we want to make sure we prime our filler, bevel up. So this is the GK point. This is the area that we want to have the higher elevation. If your patient doesn't have philtrum column, there's no need to create that. In my humble opinion, that sometimes can cause more heaviness around the white roll of your lip. So for her, she has a beautiful GK point. Thank you. So GK point, the higher point of her lips. Again, I'm submucosal, above the muscle. We're going to inject very slow, and as I'm retrograding, I also can see that I'm lifting the tissue. And you always want to leave just a little bit dot of filler at the end of your injection. Always make sure to inject slow. The key is creation a beautiful defined lip. Again, make sure we're not injecting through the muscle. If the filler is injected through the muscle while the patient is speaking, it becomes a little bit more fake looking lips. So that was my second injection. You can use your non-dominant finger to kind of guide you and assess you to lift up the lip. We always want to inject in a dry border of the lip. Keep in mind, we do not want to inject in the wet border because that will cover the patient's smile. This is a fanning technique. I have learned it from a wonderful, well-known Julie Horn that she travels the world, and a lot of providers go to her to learn from her in Switzerland. So this is a very classy, elegant technique that we can use for our lips. So I have placed 3 boluses, almost less than 0.2. Now we're gonna work on the body of her lips. I'm gonna start from her oral commissure, a little poke, and we're going to create like a little V to left the corner of her lips. Again, sub-Q, retrograde, small amount of product, and I'm gonna go back again and follow her lip above the dry wet border, and again we're going to place the product, retrograde, coming back, and there. So if you take a look, you can see the corner of the lip is going up, her cupid bow is more defined, she has more like definition and beautiful hydration. So what I did, I treat her upper right side. For the lower lip, I'll go ahead and open. So based on Julie Horn technique, we're not going to inject anything in the center of the lips. So I'm going to put this little bolus of filler, and I'm going to use that as my imaginary line, that I'm not going to inject anything in the center, but we're going to start right next to that line. A little poke. We're going to stay in the dry border between skin and muscle. We're going to call that space, as I said, sub-Q. Retrograde. Inject very slowly. As you're coming out, you're going to put a small bolus at the end of the lip. So we're going to continue with placing almost 4 to 5 small lines using this technique. Alrighty, perfect. So in order to treat the corner of the mouth and helping to bring the corner of the lip upward, we're going to have the patient open just slightly. Perfect. We're going to use our index finger to give us some support. Oral commissure, almost 30-degree, sub-Q. We're going to place the product very slowly. Be mindful you don't want to inject in a white part of their lip, because that's going to create more like a duck look lips. And then we're going to create a V. We're going to go back, retrograde, place 0.01, 0.02 ml of filler. As we're coming out, we're going to keep pushing, and you always want to leave a little bit of a filler at the end to make sure we have placed the filler in the entire tissue. Alrighty, go ahead and turn this way. There's a little hollowness here. One thing we can do is, by providing some support through the intradermal, meaning supporting the skin to improve the quality of her skin, and also providing some filler to get rid of the hollowness and also help to elevate the corner of her lips. Our angle is always going to be 30-degree, very superficial. I am not aspirating because I can't see where my needle is, and I am inside the skin, more like intradermal. Very nice. Again, use your index finger, provide some support. We can also use some fanning technique to place our filler. Kiss has a beautiful G prime. It's not too thin, it's not too thick. It has enough thickness to provide support to the tissue. Perfect. Okay. So now I'm gonna go the other side. All right, guys, so she's done with her lip filler. They look very defined, hydrated. There's about 25% inflammation. You do want to educate your patient. 24% of the inflammation will go down. So she'll see the actual result in about 2 weeks. You do want to apply a little bit of ointment. The technique that I'm using, I have learned from Julie Horn. It's more like a scratching technique with a little bit of a gentle pressure. You want to make sure you are scratching the filler, making sure it's been injected equally to the entire tissue. You don't want to put any pressure on it. You don't want to massage it too hard. That's, I think, something that I don't recommend. Again, as I said, with your finger, a little bit of a scratching technique. This is something that your patient can also continue doing at home for the first 2-3 days. It's so important to keep the area nice and clean. Well, thank you for watching the video, and please stay tuned.